When we look at addicts, we often judge their desperate actions, but we miss why they're desperate in the first place. Addiction is a coping mechanism, not the actual problem. The real issue is emotional pain, often buried deep beneath layers of trauma. The behaviors we see as harmful are, in reality, desperate attempts to survive overwhelming inner turmoil. Many of the systems in place, legal, social, and medical, fail to address this. Instead of seeing the person behind the addiction, society focuses on punishing behavior rather than understanding the cause. The Western model treats addiction as a disease to be cured, but real healing comes from addressing trauma. Addiction isn't a choice, but neither is it something that can be fixed with medicine alone. What's often missed is that these people aren't just trying to get high, they are trying to escape unbearable emotional pain. In my experience, it's possible for people to heal, but only under the right conditions. However, our current approach focuses on controlling symptoms rather than healing the root cause of trauma. We fail to recognize that the pain continues even when the drugs stop. Most addicts are wounded children at their core. Their early trauma creates shame and emotional pain, and they turn to drugs or other behaviors to soothe it. Many have experienced neglect, abuse, or emotional isolation from a young age. Trauma even affects brain development, making people more likely to rely on substances. Yet instead of addressing these root issues, society criminalizes their survival mechanisms. If we want to understand addiction, we have to ask not why someone uses drugs, but what is causing their pain.